So my name's Dr. Asim Grover. I work at the amazing Hope Medical Center and Fraser Canyon Hospital, and we serve communities from Agassiz, Hope, and up the Fraser Canyon, stretching all the way out to Manning Park, and also several Indigenous reserves as well. I think it's more learning the competencies of what's involved with addictions, also adding in the layers of cultural competencies. There are more available cultural competencies out there. The challenge lies is, everyone right now doesn't have a lot of capacity. With COVID and the pandemic and the various disasters that kind of has been happening, whether it be staff in an office arranged to physicians doing excellent work, we all only have so much capacity in the tank. When it comes to everything that happens surrounding stigma, especially when it pertains to addictions, it's really hard to understand unless you've gone or lived through it. And that's why the experiences of people that have experienced or living with addictions, it's important to understand what they're feeling, and really with sort of an open mind, acknowledging what they're feeling and trying to actually move forward and make those experiences better. Like stigma doesn't just lead to what you're feeling in the moment, but it leads to barriers and potentially further care down the road. Emotions towards the people that are struggling with addictions, and potentially an inequity of resources and care and services. And so stigma just doesn't embody just a present sensation or present feeling. It embodies layers for that person to get equitable health care. Yeah. When you're addressing the opioid crisis, I think it's important to, first of all, for all the providers and the team members to be informed. So being informed and staying up to date is very crucial in what's happening. There are a lot of agencies and teams doing excellent work, and so understanding what resources are available and what teams are available, and connecting with those, either be locally, regionally, or even provincially. What I've also found is that understanding trauma-informed care practice styles are really crucial. What that may look like when you're implementing it may be different community to community, but again, going back to cultural competencies and then implementing various forms of trauma-informed care really allow the patients to open up, to be more unguarded, and be transparent with what their underlying issues are. Otherwise, they may feel just like a number or just another patient, but really there may be someone with a name, whether it be Chris or Tom. So there's a lot of work to do. I think understanding where the funding and the resources are going and working regionally as one. And I think currently in this disaster, I've learned that at time of disaster and need, that we can work really well together. The opioid crisis is an ongoing marathon, and in my opinion, it's a pandemic that has gone for quite some time and is progressively worsening. We are implementing the measures, but I think we're learning more about ourselves as new forms of drugs are circulating, and new mixtures. And so we have a lot to learn, and I think in this part, working together with all everyone that wants to help is going to be key in sort of overcoming this.